everyone, my name is Franz Jasmine Swaner-Yap, your student nurse from Davao Doctors College. And today, I am going to assess the anterior and posterior thorax. So this evaluation of thorax is an essential component of a complete physical examination. The traditional systematic approach involves the inspection to be followed by the palpation, percussion, and auscultation of both anterior and posterior thorax. This assessment helps us determine if the patient has any abnormalities. So first thing we do is that review the client's medical record if available, determine the scope of the assessment if needed. This is done to know the extent of the patient's physical examination. So now we need to prepare the necessary equipment that we needed during the assessment, such as the stethoscope, the marker, the measuring tape, sterile gloves, patient's gown, and of course, the comprehensive assessment. And don't forget to do hand washing before doing the assessment to prevent the spread of the microorganisms. So before doing the assessment, greet the patient, introduce yourself, identify the client using the two identifiers such as name and birthday, ask how the client would like to call during the assessment, and of course, explain the procedure to the client on how he or she can participate during the assessment. Then, ensure the client's comfort, privacy, and confidentiality. Then let the client sit comfortably. Now, inquire the client about having a thorax health history if he or she may have a respiratory health condition. Therefore, gathering information about previous illness will help us on how to perform a more accurate respiratory assessment. Hello, ma'am. May I come in? So before entering the room, it is important to ask for the patient's consent. Hello, ma'am. Good morning. My name is Franz, your student nurse for today. So may I know your name? Okay. So what is your birth name? Okay. So what do you want me to call you? Okay. So Althea, I am going to assess your thorax. So the procedure that I will be doing is that I'm going to touch and expose some parts of your body. Then there are some movements and procedure that you should follow. Is that okay with you? Okay, so but before that, I have some questions to be followed. So, do you feel chest pain? Okay. So, do you observe wheezing when you breathe? Okay. So, do you have a problems of breathing? So, are you asthmatic? Okay. So, the information that I will be getting out Althea is secured and safe to hand it to the doctors. So as you can see, I've closed the curtains so that it can provide us privacy and confidentiality. So now, do you have any questions or clarifications? Okay, so let's start the assessment. So for surveying the chest and respiration, check for the signs of the respiratory distress and problems of the oxygenation. Observe for the color of the face, lips, chest, and fingernails. Then, palpate the suprasternal notch and note for the position of the trachea. So, Althea, can you exhale and inhale for me? Okay, one more. Okay, so now I'm going to observe the color of your face, your lips, and chest, then fingernails. Okay, so can you turn your head to the left side? this side. Okay, thank you for that. In the examining of the posterior thorax, first inspect for the configuration. While the client stands with her arms at the side, stood behind the client, then observe for the scapula and the shape and configuration of the chest wall. So I'll say, is that okay that I'm going to touch your chest? Okay, so when you turn around for me, okay, thank you for that. So the second one is to inspect the spinal alignment for deformities. From the lateral position, observe the three normal curvatures, such as the cervical, thoracic, and the lumbar. Now, to assess the lateral deviation of spine or the scoliosis, observe the standing client from rear and have the client bend forward at the waist, then observe from behind. So, Althea, can you bend for me like you are tying your shoelace? Okay. For the third one is to palpate the posterior thorax. Assess the temperature and integrity of all chest skin. Palpate all thorax areas for bulges, tenderness, or abnormal movement, especially if the client has a complaints about the respiratory problems. So, Althea, I'm going to touch your chest wall or posterior thorax. Is that okay? So for the fourth one is to palpate the posterior thorax for respiratory excursion or thoracic expansion. Place both of your hands to the lower thorax, then thumbs adjacent to the spine and fingers stretch laterally. Ask the client to take a deep breath while you observe the movement of your hand or any log-in movements. So, Althea, can you inhale and exhale? One more time. Again. Okay. The fifth one is to palpate the thorax for vocal tactile or fremitus. It is faintly perceptible vibration in the chest wall if the client speaks. Place the palmar surface of your fingertips to the posterior thorax, starting near at the apex of the lung. Ask the client to repeat the words such as blue 1 or 1, 2, 3. Repeat the two steps subsequentially, moving to the base of the lungs. Compare the fremitus of both lungs and between the apex and the base of the lungs. So, Althea, say the word blue moon as I palpate your posterior thorax. Is that okay? Okay. Okay, thank you. So the sixth one is to percuss the posterior thorax. Ask the client to bend the head and cross the arms forward and across to her chest. Percuss the intercostal spaces about 5 cm. Intervals into the systematic sequence. Compare one side with the lung to the other. Percuss the lateral thorax every few inches, starting at the axilla and working down to the 8th rib. So now, Althea, I'm going to percuss your posterior thorax. So for the seventh step is to measure the diaphragmatic excursion. Use percussion to identify the level of the diaphragm and measure the diaphragmatic excursion. Percuss downward from above the expected level of diaphragmatic dullness until dullness is definitely heard. Then mark the level of the expiration. Have the client to inhale deeply, then hold it. Then percuss downward to the level of dullness and to the level of the full inspiration. Repeat this process to the other side. Then measure the distance of the expiratory and inspiratory of the dullness. So now let's proceed to the measurement. So Althea is dedicated on going to mark at your back. Okay. So can you inhale, then hold it for me. Okay, exhale. So inhale, then exhale, then hold it for me. Okay, so let's proceed to the other side. So can you inhale for me? Then hold it. Okay, exhale. So inhale, then exhale, then hold it for me. Now for the eighth procedure is to auscultate the breath sound. Auscultate the thorax using the flat disc diaphragm of the stethoscope. The diaphragm of the stethoscope is the best transmitting sound with the high-pitched breath sound. Now, while doing the percussion, use the zigzag procedure. Then now, ask the client to take a deep and slow breath sound through the mouth. Listen at each point to the breath sound during a complete inspiration and expiration. Compare the findings at each point with the corresponding point of the opposite side of the thorax. Then don't forget the location or note the location of the chest wall where the adventitious sound are heard. So now let's proceed to the procedure. So Althea, can you inhale and exhale for me as I say so? Inhale. So for the ninth procedure is to auscultate the breath sound. Bronchophony, ask the client to say 99 while auscultating the chest wall. Egophony, ask the client to say E while auscultating the chest wall. And then whispered pectoral logi, ask the client to say 1, 2, 3 when auscultating the chest wall. So Althea, say 99 for me as I check for your chest wall. Okay, so now Althea, say E. Now whisper 1, 2, 3. So now let's proceed assessing the anterior thorax. First, inspect for the breathing patterns, then inspect for the costal angle and the angle at which the ribs enter the spine. So Althea, is that okay that I'm going to touch your chest? Then, so Althea, can you inhale and exhale for me? Okay, one more time. Okay, so now let's proceed to palpate the anterior thorax. So first, using your fingers, palpate the tenderness and sensation. Then start palpating your hand over the left clavicle. Then move your hand left to right, comparing findings bilaterally. Then move your hand systematically downward toward the middle line at the level of the breast and outward the base to include the lateral aspects. Repeat the sequence to palpate for the crepitus and fremitus of the anterior. So, Althea, is that okay that I'm going to touch your chest? Okay. So now let's proceed to palpate the anterior thorax for the respiratory excursion. Now place your palms, both of your hands, along the lower thorax, with your fingers along laterally to the ribs, and your thumb along the costal margin. Ask the client to take a deep breath while you observe the movement of your hands. So, Althea, can you take a deep breath? Okay. Okay, take a deep breath. Okay, repeat. Now, let's begin percussing the anterior thorax systematically. Begin above the clavicle in the supraclavicular space and proceed downward to the diaphragm. So, Althea, can you lay on the bed? Okay, so I'm going to start percussing your chest. So in the last part of assessing the anterior thorax, auscultate for the anterior breath sound, adventitious breath sound, and the voice sound. First is to auscultate the trachea. Then, auscultate the anterior thorax. Now, place the diaphragm of the stethoscope firmly and direct to the anterior chest wall. Then, auscultate from the apices of the lung, slightly above the clavicles, to the bases of the lung, at the sixth rib. Ask the client to breathe deeply through the mouth in an effort to avoid transmission of sound that may occur with nasal breathing. Listen at each sound at least one complete respiratory cycle. Then listen to the normal breath sound, add adventitious breath sound, and the voice sound. So now let's proceed to the procedure. So Althea, can you sit for me? So, Althea, take a deep breath from your mouth. Thank you for that. So now, after doing the procedure, the assessment, summarize all the information obtained during the working phase, discuss the finding to the client, ask the client or provide the client the opportunity to ask or raise for her concerns, then thank the client after ending the interview politely. Then, of course, don't forget to thank the client for her time and effort, and of course for her participation. Then don't forget to do hand washing. Hello again, Althea. So about your assessment, I'm going to read what the findings. So regarding the surveying the chest and respiration, no respiratory distress or problems with your oxygenation. It means normal and good. So in examining the posterior thorax, your spine is systematically aligned, spinal column is straight, right and left shoulders and hips are at the same height. And of course, during the palpation of the posterior thorax, your skin is intact and your temperature is uniform. For the respiratory excursion, you have a full and systematic thorax expansion. So for the thorax for vocal fremitus, you have a bilateral symmetry of vocal fremitus. And fremitus is heard clearly, which is good. So during the percussion, you have a normal because resonance, except over the scapula. So it notes resonate except over the scapula. So for the diaphragmatic excursion, the vesicular and bronchovesicular breath sound. So for the auscultate breath sound, you have a quiet rhythm and effortless respiration. So in assessing the anterior thorax, we palpate anterior thorax and it is a full systemetry. So during the percuss, resonate sound the sixth rib, flat over the area and heavily muscle, down on the areas over the heart, and the tympanic over the underlying stomach. So in auscultating your anterior thorax, you have adventitious breath. So your finding shows it is all good and normal at all. So don't forget to do exercise and stay healthy at all the time. And do you have any clarifications or concerns? Okay, so thank you for your time and effort, Althea. So if you feel uncomfortable or triggers you, feel free to come back here so that we can run another assessment. So am I all clear or do you have any clarifications or concerns? Okay, so thank you for your time and cooperation, Althea. And hope that you stay healthy and have a good day.